My name is Joshua Park. I'm from Dankook University. A patient was referred to me with the missing state on tooth number 21. It seemed that the tooth was maybe extracted 4 to 6 weeks ago because there was an incomplete healing of the soft tissue on buccal side. Using blade number 12, I have placed crestal incision on slightly palatal side and also placed clavicular incision using blade number 15. Using the Auburn knife, or sometimes called interdental knife, was used to reflect the flap, and I gave a great caution not to perforate the thin buccal flap. Due to the limitation of surgical field of view, I went for an additional horizontal incision on the base of papilla of the adjacent teeth. And I'm not a big fan of vertical incision, and I can easily get a satisfying flap reflection every time. So I'm happy with the horizontal incision. Using different instruments, a granulation tissue was completely removed before the osteotomy. And most importantly, I used the implant guide from Dentium because it gives me an idea where the ideal implant position is. Also, ellipse parallel pin was used to measure the horizontal dimension and to find the ideal path of implant. Then using the sequential drills, I continue my osteotomy, and from the guide drill to final drill, I keep tracking the path of implant at every stage since I prefer to have a screw-retained crown instead of the cemented crown. Finally, the Superline implant 4.5-8 mm fixture is inserted using the engine, and the final depth of the implant platform is corrected using hand ratchet. Again, the path of fixture is checked using the path pin. Since we need to perform GBR to cover the adhesions on the buccal side, I connect the cover screw and carefully a periosteal releasing incision is placed. I'm checking whether I can close the flap with passive tension. Alloplastic graft materials mixed with collagen is grafted on the fixture on the buccal side and also slightly over the fixture. The reason for this is that I want to compensate the resorption of the biomaterials during the healing period of maybe 3 to 4 months or sometimes 6 months. The great advantage of this biomaterial is that it's moldable and it's very easy to apply over the defects. Now I place the resorbable collagen membrane over the bone graft. Before the application, you need to hydrate the membrane at least for 1 minute. Otherwise, it will be very stiff and difficult to apply over the defect. Personally, I prefer to use additional membrane because it's the concept from double layer technique from Professor Bujer. Now, it is time to perform a suture. I think that suture is very important, so I take a lot of attention to the suturing techniques. In this case, I performed a single interruptive suture on the medial side, and on the distal side, another simple interruptive suture is performed. And in the middle portion, it's very easily to be exposed because of the tensions from the swelling or the bone graft. So at this point, I place the modified lower suture, which is basically a horizontal internal matrix suture with everting forces, and it can heal the flap more easily and more rapidly. Because I placed the additional horizontal incision line on the adjacent teeth, I have to place another interrupted suture on the horizontal incision line. So that's the end of the first stage surgery, and this is the 6th month after the final prosthesis. This is the pre-op, and this is the after implant placement and GBR, and this is after the 2nd stage surgery. Well, it is well known that maxillary anterior lesions are tricky areas since it is very difficult to get an aesthetic results. However, with a well-established surgical method and the biomaterials with scientific evidences, you can get a satisfying result without too much concerns. Bam! Well, thank you very much for watching this video presentation, and another case will follow after this. See you later. Bye-bye.